Hello, welcome back to our channel where we talk about everything you need to know for a healthy and happy sex life. Today we are diving into a topic that is both important and sometimes a little taboo: common sex injuries and how to treat them. So let's jump right in. Penile fracture. First up is the infamous penile fracture. Yes, it sounds scary, and yes, it can be a serious condition. This happens when there is a traumatic rupture of the penis's fibrous covering during rather enthusiastic sexual intercourse. Imagine this: you hear a sudden crack, followed by intense pain and rapid loss of erection. It is not fun at all. You might even see swelling, bruising, and in severe cases, a deformed penis. If this happens, don't panic, but also don't wait. Seek medical help immediately. Go to a sexologist who will take an ultrasound or MRI to assess the damage. The sexologist will then advise proper treatment and help you regain your sexual well-being. Strain muscles. Next, let's talk about strained muscles. We all know that awkward position or that moment when you push just a bit too far. These strains can hit any part of your body, including the back, neck, or pelvic muscles. You will feel localized pain, stiffness or soreness, maybe even some swelling or bruising. But you do not need to worry, as these are not typically serious and mostly heal on their own. You can give symptomatic relief with the RICE method, which is rest, ice, compression, and elevation. Peyronie's disease. Now, Peyronie's disease isn't caused by sex exactly, but it can really affect your sex life. This condition happens due to fibrous scar tissue in the penis, which can cause painful curved erections. This curvature can make sex uncomfortable and tricky, but there are ways to manage it. Consult a sexologist who can offer treatments ranging from medications to surgery depending on severity. Genital bruising. It can happen due to rough or intense sexual activity and might cause discoloration and tenderness. You might see anything from mild redness to deep purple hues. It might look a little scary, but it usually heals on its own. You can treat bruising with ice packs, pain relievers, and some downtime. To prevent it from happening again, communicate, set boundaries, and always use lubrication.
Erectile dysfunction. While ED isn't a sex injury per se, it can definitely impact your sexual performance. ED means struggling to achieve or maintain an erection, and it can stem from various physical and psychological causes. The treatment involves a mix of medical interventions, lifestyle changes, and psychological support. See a sexologist to get to the root cause and find the right treatment plan for you. Sexually transmitted infections. Finally, let's talk about sexually transmitted infections. These infections can be disheartening, but are mostly preventable with the right precautions. Sexually transmitted infections can cause symptoms like genital sores, pain, and discomfort. Early detection and treatment with a sexologist is crucial. Practice safe sex, get regular testing, and communicate openly with your partners. You can use condoms and consider monogamy to reduce your risk. Remember, understanding these common sex injuries can help you enjoy a healthier, more fulfilling sex life. One major takeaway: don't hesitate to seek professional advice from a sexologist if you need it. Hit that subscribe button for more tips and insights.